Dharmender. I'm the director and principal physiotherapist at Move Physio. And today we are going to discuss about various exercises which can help you in improving from COVID-19 related weakness. So COVID-19 symptoms generally they last for 2 to 3 weeks, and they can the various patients show various symptoms, and in some people they resolve spontaneously, while in other they require hospitalization as serious damage happen, and even they develop pneumonia, lung damage, so they require hospitalization, ventilators. So coming out of it, it takes time, and also it has been observed that even 1 week of ICU stay can reduce the muscle mass by nearly 10%. So it's very important for all of us to be aware of what all exercises can help us in coming out from COVID-19 related weakness. Okay, so before we proceed further, we always need to take care of all the precautions and emergency signs which can happen while performing the exercises and even during the rest time. So if you experience any of these symptoms, emergency signs, you need to consult a doctor. So don't proceed with the exercises, consult a doctor first, and then proceed with the exercises. Okay, so there are different levels of performing the exercises for COVID-19 related weaknesses. There are 3 different levels which have been mentioned: level 1, 2 and 3. So it depends on what is your level of activity. So if the person is fully bedridden, or like there's so much weakness that the person is mostly lying, they have to start from level 1. If they are able to do activities in sitting, then they can perform level 2 activities, and if they are still better, can perform level 3, which is mostly in standing position. That will be much better, like they can perform all the activities related to standing. Okay, so in level 1, the person is really weak and mostly on the bed, and they can perform the exercises which I'm just going to demonstrate to you. They can perform all these exercises. They can start with 2 to 3 times in a day, and then can progress to 4 to 5 times. And whenever they can perform all these exercises without any trouble, 2 to 3 times a day, they can actually proceed to level 2. So what are these exercises? All right, let's start with them. So the first one is ankle pumps. So you have to move your ankles up and down. You can perform them 2 to 3 times and then proceed to 7 to 8 times. All right. Next one. Next one is in the lying position. You have to bend the knees and then straighten them. And then straighten them. So again you can perform them 2 to 3 times and then progress to 8 times. Next one is putting one leg over the other and hold this position for 10 seconds. And similarly, you can do it with the other leg and hold the position for 10 seconds. And again, you can perform this for 2 to 3 times and then proceed to 8 times. Next one is the arm movement. I will slide down a bit for that. Okay, so the next one is arm movement, lifting the arm overhead. So you can perform this 2 to 3 times and then gradually can progress to 8 times. And similarly, going from sideways. All right. Next, in the sitting position, you can do is touching your upper back. and then touching your lower back. All right. So all these basically level 1 exercises. Besides that, you can perform sit to stand activity with the help of a support. So you can hold somebody's hand, or you can support any chair, and you can perform simple sit to stand activity, which can be performed 10 times in a row. And then simply sitting on the bed for as long as you can. That will also improve your like all the activation around the core muscles, and your seating ability and balance will improve with that. So all these exercises are level 1 exercises, and once you are able to perform them like at least for 2 to 3 times in a day, then you can progress to level 2. And again, be careful with all the emergency signs, all the precautions. If you experience any of these symptoms while performing the exercises, please stop your exercises and consult a doctor. Okay, then we can move to the level 2. So in level 2, we are majorly going to perform all the exercises in sitting position. And have already explained you, when you can perform level 1 exercises comfortably, you can proceed to level 2. But the progression can be done in a way where you can take few of level 1 exercises and few of level 2 exercises can be added to that plan. So you have to gradually do all these exercises, and when you are able to perform all the level 2 exercises, which I'm going to demonstrate just now, then you can proceed to level 3. So again, you should be able to perform level 2 exercises 2 to 3 times in a day. Of them are in sitting position. So the first one is, you are going to bend your neck and then look up. So perform it 2 to 3 times, and then you can progress to 8 times. Next one, looking sideways. Okay. Next one is the shoulder rolls. So 8 times forward shoulder rolls. And 8 times backward shoulder rolls. Alright, next one is the finger stretch. And you're going to hold the position for the count of 8. Similarly, you're going to do it on the other side. Alright, next one is the calf stretch, which I'm going to show you a little later. Then is the bicep curl. So you can put some kind of support or a pillow, and then you can hold some weight in your hands, like 2 to 5 pounds of weight, and then can perform these wrist curls, and you're going to perform them 2 to 3 times, and then gradually can progress to 8 times. So you're going to do it on the other side as well, and then holding the weight, you can go for bicep curls. Alright, next one is the overhead shoulder movements. So for that, you can lift some kind of weight. So this is very light pillow or cushion. You can hold something heavier, and then can lift up and bring it down. And similarly, you can hold some kind of weights in the hands and can go sideways. Alright, and then is the tummy twist. So basically you're going to hold some weight and then going to twist sideways. So all this you can perform 2 to 3 times and then can proceed to 8 times. And it's always better if you have a therapist with you who can guide you and can see what is your current level based on your strength and the endurance, and he can actually make some changes or fine tune your exercise plan. All right. So the next one is with the legs. So you need to lift the leg. So again, you can perform 2 to 3 times on each side, and then progress to 8 times. And then knee straightening. Alright, so level 2 exercises are, all these exercises are in sitting position. So once you are able to perform all these sitting exercises at least for 2 to 3 times in a day without any trouble, you can progress to the standing exercises or level 3 exercises. So let's start with level 3 exercises. So I'm going to show you some stretches first. So first one is the overhead stretch. You have to keep your feet slightly like shoulder width apart and hold your arms like this above and stretch your body upwards and hold the position for 15 seconds. And perform these stretches 2 to 4 times. So this is first one. Second one is the side stretch. So in the same position, you're going to lean sideways. And similarly the other side. Alright. Third one is the tricep stretch. So hold your arm and pull it like this. I can show you from behind. So hold it again for 15 or 30 seconds and perform them 2 to 4 times. Next one is quadricep stretch, which you can perform in lying position, or if you can perform in standing position, then and you can always take a support as well. So I can show you from sideways as well. Next one is the calf stretch. So for that, I need to take support from a wall, and then I can lean forward. I'll be slightly bending my forward leg while keeping the back leg straight, and heel should be supported on the floor, and again hold it for 15 to 30 seconds. Similarly, you are going to do it on the other side. Perform it 2 to 4 times. All right. And next one in standing position. You can take a support from a chair, and then you have to move the leg sideways, lift the leg sideways, hold it for 8 seconds or for the count of 8. And for the better view, I can show it from the front as well. So hold it for the count of 8, and then perform it 2 to 3 times, and then progress it to 8 times. Next is hamstring curls. So for that, here again you'll be standing in similar position, but you're going to bend one knee while keeping the other leg slightly straighter. Slightly bent at knee. And again, hold it for the count of 8. Do it on the other side. Alright, next one is the supported squats. So again, you can take the help of this chair, and then you're going to squat. Hold it for the position of 8 seconds, and then stand up. Perform it 2 to 3 times, and then you can progress it to 8 times. And again, you can use some of the level 2 exercises like the bicep curls, wrist curls in level 3 as well. And then you can do walking for 10 minutes, which you can perform 3 times in a day. And okay, I missed something. So in all these 3 levels, you have to perform some breathing exercises, which are, first one is the deep breathing exercise. So I showed some deep breathing exercises in my last video. You can check it there. Second one is your pursed lip breathing. So you have to perform both these exercises for 2 minutes. And then the third one is using the incentive spirometer. You have to do some blowing exercises, which you have to perform for 10 minutes. So in all these level 1, 2 and 3, you have to perform these 3 breathing exercises. And also in all these levels, you have to do resting at least for 10 minutes. So you can put a pillow under the knee, one under the head, and just simply in the lying position, like lying on your back, you can rest for 10 minutes. So that is also part of this exercise plan at each level. So then gradually you can progress to other activities, and also these exercise plans can be modified based on individuals' pre-COVID status. Like some people are really active and they might not be that much affected with the COVID. So they can progress little faster, while others who are mostly sedentary and then they don't do exercises, they might have to go through all the levels. So these plans can be individualized as well. And also last time I said wait for at least 1 week or 7 days. Let your symptoms go away completely. So that wait for that asymptomatic phase. Once you are out of that, then you can start with these exercises. So with this, I would like to end this video. And yeah, just always remember about the emergency signs and precautions. And yeah, that's it. So I'll catch you soon. Take care. Bye.